Tamworth Community Nurses Association. I'm going to introduce Julie in a second. If anybody wants to know what we do as Tamworth Democrats, come up to me or Genevieve after. And with no further ado, this is Julie, who's a daughter of Mount Washington Valley, has been with the TCNA for just over a year and is already a mover and shaker in town. And I'll let her talk a little bit about TCNA and then we'll
all right.
the presentation. Yeah. Thank you all for being here.
Thank you all for coming. I promise I'm not going to talk long because what I really want is for us to have an opportunity to hear the experts in the room. So I am Julie, I'm the Executive Director of Tamworth Community Nurses. I see a lot of familiar faces who I think already know about TCNA, but if you don't, we serve the residents of Tamworth, and we've been doing that for 104 years, when some women got together and said everybody in the town should have access to a nurse at no cost to them personally. And so that's what we do. So if you have a new health issue and you're trying to navigate the increasingly complicated medical system we have, we are here to help you. We do lots of things. There's some info over there if you want to read about it. But most importantly, in the last year, we've been really recognizing changing needs in the community and wanting to host community programs to help us all be as healthy as we can. Programs like this one. So we're very happy to have community partners supporting us with that. So I'm going to introduce to you our presenters tonight. We have a dynamic duo here. Mother and daughter duo colleagues, Nancy and Olivia. Nancy's focus is really servicing families and individuals as they're navigating the complexities of the individual health insurance market as well as transitions to Medicare, which is what we're talking about tonight. You can tell they're really dedicated because they drove all the way from Portsmouth to be with us tonight. Thank you very much. So they each help assist clients find affordable plans for their specific needs, and Nancy specializes in complex situations, appeals, and special enrollments. Also licensed as a health and life insurance agent, Nancy stresses the need for families and individuals to learn more about life insurance and how that can serve in multiple capacities, not just in the traditional way we might think. And Olivia is helping her with all of that. We also have another person here, and that is Amanda Lepar. Thank you for being with us. She's from, is it Duran? Duran Independent Insurance, also a licensed agent, and they're going to tell you more about what they do because we want this night to be plenty of time for all your questions. All right? Thank you.
Okay, thank you. Thanks for having us. Am I still muted?
So I guess we're live. Everybody at home? I'm going to try and talk loud. You can interrupt me with your questions if you have a question, or we could wait. It's really your call. What we're going to do tonight is present basically the ABCs of Medicare, kind of do an overview, and then what we were invited here tonight to talk about is the Part C. It's going to be an educational presentation. But in Carroll County, we are losing Advantage plans. So there are going to be a lot of questions, I'm sure, about what that looks like, what are your options, time frames, and we're going to help you all. We'll stay tonight after the presentation and make sure you get all of your questions answered. This is not a normal year in health insurance, right? We are all working 7 days a week right now and have been since October 15th. So over 77,000 people are losing insurance plans, Advantage plans in the state of New Hampshire this year. I think 5,700 in Carroll County alone. So there aren't enough people. There are not enough agents to help everybody transition. And I've even, at the last presentation we did, we heard that ServiceLink is booked up until 12/31. So trying to even get with a professional person that might be, available in your community is hard to do. So if you are losing your Advantage plan, you do have until 12/31 to make a change. You also have a couple months after that too. Since you are losing your insurance, you will have guaranteed issue rights to a supplement, and we'll talk about that down the road, okay? So to the basics, Medicare. When you're first turning 65, you are eligible for Medicare, and you have the 3-month window before your birth month, and then the 3 months after to make decisions about what you're going to want to do. Oh, and I should speak a little bit about why we have two agencies here tonight. I'm Nancy Papp, Portside Independent Insurance. I was born out of Duran Independent Insurance. So I used to work for my brother, Paul Duran, at Duran Independent Insurance over 12 years ago until I bought my book of business, moved to Portsmouth, and we still are sister agencies. I'm working out of the Wolfboro office Tuesdays, Saturdays, and Sundays. Amanda Lepar, newly licensed. Olivia Papp, 24-year-old newly licensed agents who are meeting with clients this year and able to help answer all of your questions. Original Medicare. When I first started doing Medicare 101s, I thought, how confusing is this when you're over parts A, B, C, and D, right? Original Medicare is parts A and B. Hospital coverage is A. Doctor coverage, specialists, labs, outpatient services, all of those sorts of things fall under Part B. C, that's Advantage plans. That's what we're talking about tonight. That's the one card that does everything. D is prescription drugs. All right? Original Medicare, by the way, has been around since the 60s when Lyndon Johnson signed it into law, so decades. Original Medicare has been with us. So a little bit more into what is Part A. If you spend the night in the hospital, right? If you spend a night in the hospital, Part A is there's no cost for that, but there is a deductible. That deductible goes up, creeps up a little bit every single year, but spending a night in the hospital, if all you had was Original Medicare, you will be on the hook to pay a little over $1,600. That $1,600 will buy you 60 days in the hospital, right? That's why sometimes people look to supplemental insurance for that reason. Yeah, so, and resetting every 60 days, Olivia makes a good point. How that looks like, you could meet that multiple times in a calendar year, right? So January, you fall, you break your hip. 3 months later, you have pneumonia, you're back in the hospital. If all you had was Original Medicare, you could meet that $1,600 multiple times in a calendar year. Skilled nursing. The type of skilled nursing that is covered by Medicare is the type of skilled nursing that if you fall and you break your hip and you needed someone to come into your home or you needed to go to a facility, that is going to be covered by Medicare. The I need to be in a skilled nursing facility because I can no longer feed, bathe, dress myself, that is not covered by Medicare. That is something that is completely different. And your questions, after the appointment, we can certainly talk to you about what that looks like. And Medicare will cover the first 20 days. You'll notice on this presentation, and you can take these home if you wanted to share it with friends and family, after the first 20 days, there is a copayment for skilled nursing, a little over $200 a day. And the same thing rings true for after that 60 days that Medicare covers. Day 61, $419 copay. After 90 days, $838. So Original Medicare, nice that Part A is free, but you do have to understand that free in premium doesn't mean free in exposure. This is why people look to supplemental plans. I think we're on to the next slide. And girls, help me out if I'm forgetting anything. Please just step in. Yes.
So you're saying that days 1 to 60 of a benefit period means per incident, per accident,
occurrence.
per occurrence.
Correct.
So if you are only in for 10 days, you pay the $1,600, and then
Most
maybe
likely-
2 months later you have to go in for another 10 days, you have to pay $1,600 again.
Correct. Yeah, so not an annual exposure.
But so say you're in the hospital for 5 days, right? There's your first 5, you leave for maybe 10. You come back, you're still within your 60 days.
Right.
So you could go in and out of the hospital a bunch of times within those 60 days. Once you leave after the 60 days, if you're not there, say it's 5 days that you're gone, you come back, that benefit period starts over again.
So Part B, this is the second part to Original Medicare. Original Medicare is parts A and B, B being doctors. There is a premium for Part B, If you're taking Social Security, that premium comes right out of your check. You might not even notice that you're paying it, especially if you have an Advantage plan and you've had an Advantage plan for a long time. When it comes right out of your check, you don't realize, but that is a cost that you are paying for Part B. 185 was the amount, the held harmless amount. In 2025, that is going up next year to 202.90. 202.90. Every year these things creep up a little bit. And you know, Part B is doctors, specialists, labs, x-rays, all outpatient services are falling under that Part B. There is a premium, there is a deductible, which is annual, $283 in 2026 is going to be the annual deductible, which is no big deal. But the 20% after that deductible is a big deal. And that's an infinite 20% with no stopgap, right? So on an Advantage plan, and you know when you're looking at those Advantage plans and making choices, you've got an in-network this is the worst case, 7,000, 6,000, whatever it is, out of network, 9,000, 10,000. With Original Medicare, which if you are losing your Advantage plan, you will be back to automatically on January 1. That 20% is something you need to pay attention to because that could go on forever and ever. Like there's no end to that. Why? Yeah. Do you have a question? Okay.
It's an interesting word.
It's an infinite. It's an infinite equation is how I explain it.
So what
Yeah.
you're saying is that those charges that you pay 20% on, they don't accumulate into a total that is your deductible.
Yeah, there is a deductible, but it's like the max out of pocket that's missing. It's 20%.
After
Just-
you hit that Part B deductible,
Yeah.
the Medicare pays 80 and you're responsible for 20% of everything after that until, January 1st of the next year.
Yeah.
Then that deductible restarts and then you
Yeah.
have to hit it. But yeah, once you hit that Part B deductible, it's 20% of everything after.
Nancy, would you repeat the questions just for the television
Yes.
audience because they might not be keeping
Yes.
up?
Great
Next time, you
idea.
don't have to go.
Right, great idea.
So this is why people get supplemental to make up that 20%?
Yes, because Original Medicare is great. Part A, free. Part B, little over $200. It gives you a nationwide network, right? So you're going to Mass Gen, Brigham and Women's, Dana-Farber. Most likely, most of your providers and specialists who accept the Medicare contract are going to be in network. The days of shopping, are my specialists covered by this plan or this plan, are really mostly over because Medicare is so broad, most providers will accept Medicare. And then the supplement will follow suit if you choose to go back to a supplement, right? Okay. Part C, why we're here tonight. So Part C, if you went with Original Medicare supplement, still are you not covered by drugs, right? So that's 3 cards, which can be kind of clunky. It's a good place to be, but one of the advantages to Advantage plans is that it is one card that does everything. It includes drugs, it includes health, you've got an in-network, most of the time you've got an out-of-network benefit. And in the state of New Hampshire, since 2012, we've had lots of options. Some years close to 30 options to choose from, multiple different carriers. In Stratford, Rollinsford, Rockingham County, we still have Advantage plans, but in Carroll County, we have one, which we can talk about if anybody has questions. At an educational event, we're not necessarily supposed to really delve into, specific carriers, but we'll talk about other options than an Advantage plan if you are, if you're interested in what if we didn't want to do an Advantage plan? What would be our choices? Yeah, the Advantage plans are great also because they are lower cost, right? With Original Medicare and a supplement, you're paying Part B as well as a premium for a supplement and then a standalone drug plan. A nice feature about the Advantage plans is we have had 0 premium PPOs in the past. You just pay as you go. So, with that mentality, It really is. We're going to stay healthy. I'm not going to go to the doctor very much. I probably won't hit my deductible or my max out of pocket. And for a lot of people, that really does work. So unfortunate we don't have those plans to choose from.
Will you cover why?
Will I cover why? So, you know, the Insurance Commissioner website does have information. If you're scrolling on any social media platform, you will probably read lots of people's opinions about why that's happened. I read one just the other day from the Insurance Commissioner. It's kind of a perfect storm, if you will. Carroll County has an older demographic. Not a lot of, like, the population is small. We don't have a lot of big hospitals around. So the actuaries, the people behind the scenes who figure out if this will be a profitable county for them to offer a plan, are really saying not so much. We can point our finger also at the Inflation Reduction Act, the CARES Act. So some of these pieces of legislation are making it more difficult for Advantage plans to operate in the state. Capping the prescription drug donut hole, reducing the cost of insulins, lowering the cost of drugs for seniors. All of that stuff is good, but you'll notice in the Advantage plans, they have that drug component built in. Just similar to how 3 years ago, we had close to 30 prescription drug plans, then 21, then 14, now we have 9 to choose from. That same similar plans exiting the state of New Hampshire has to do with legislation that's supposed to drive down costs for seniors. Insurance carriers are considering whether or not it's a viable business. That is part of the problem. So perfect storm. CARES Act, Jean Shaheen was involved in the CARES Act a little bit, so we can say, you know, the Joe Namath ads on TV, you're not really seeing those anymore. Call centers with people calling up seniors and asking for Medicaid. There's a lot of rules now where agents have to be recorded when they're having a sales presentation. So some people, you know, happen to enroll in an Advantage plan almost maybe even by mistake. And it would be the representatives of the state of New Hampshire, the insurance commissioner, our senators that would get those complaints. I didn't understand what I was enrolling in. You know, I was really excited about the wellness wallet or the gym membership discount, or they're going to pay for my, my ski pass, something like that. And then, heaven forbid, you get cancer and you can't go to Dana-Farber. These were the issues. Brokers are supposed to lead with that, honestly. We're supposed to lead with who's in your network, what are your must-have doctors, what are your must-have specialists, and you know, not so much about all of those other bells and whistles. So the sales tactics themselves, brokers aren't allowed to do that so much anymore. Yeah. Yep.
About Advantage plans, which you might know, is that they do have the benefits sometimes of dental and vision. You have those fun benefits with Advantage. Medicare does not offer benefits like that with dental and vision. If you wanted dental and vision covered, it would be a separate policy.
We have Delta Dental rate sheets up here and VSP brochures too.
So, Part D, that is prescription drug plans. If you were contemplating with your losing of your Advantage plan that you might want to go back to original Medicare with a supplemental plan, none of those things cover prescription drugs. Prescription drugs would be your third card in your wallet. There are 9 plans, 4 of them next year are 0 premium. It is very important that you shop your prescriptions and not just choose any plan, especially based on premium. These plans can change everything about themselves from year to year. They can exit the market, change their formulary, their deductibles. There is a cap of $2,100 next year in 2026. So making sure that your drugs are, I'll give you an example. I met with a gentleman a couple weeks ago, and he takes a drug called Rytary, R-Y-T-A-R-Y, for Parkinson one-offs. That drug is only in 1 plan next year. So shop, if you are on a drug plan and it was in your formulary last year, you cannot assume it will be in the formulary next year, and that would have been a $16,000 mistake to assume that your drug is going to be in formulary next year. So get with an agent, go on Medicare.gov, do the due diligence of making sure that your meds are definitely going to be in the formulary for next year. Yep.
At the same deadline of 2 months after?
Yeah. So, yes. So the question is, do you need to get on a drug plan by December 7th? Is the deadline of December 7th the same? I am curious about that. I think you have extra time to pick up a drug plan. Yeah. I mean, I can, yeah.
So it is important to know, does your Medicare Advantage cover prescription drugs? Because not all Advantage plans have the Part D.
We don't have that now, so why even talk about it?
Oh.
Because, so if you're on an Advantage plan now with no prescription drug coverage, right, there's a Part D penalty for not being enrolled in prescription drug coverage.
Yep.
So if you don't have prescription drug coverage right now, and then you're losing your plan, it may not be the smartest idea to get on a prescription drug plan, because then you accumulate the Part D penalty. So you'd be paying out of pocket for your drugs like you are right now. If you have prescription drug coverage built in with your Advantage plan, then you want to shop the Part D coverage.
I don't understand what you just said.
I know.
Yeah. So every person is different. Every person's situation is different. Let's do an example. I have a client in Wolfboro who is a naturopath, and she forages for all of her medicines. And it makes no difference to her if she were to ever have a drug component built into her plan. No difference. All she cares about is the health portion. And she would go or enroll herself in a plan that didn't have a drug plan on purpose, because maybe that plan would give you a buyback on your Part B. So when you say, we don't have any choices next year, not 100% sure everybody here is in Carroll County, number one, and there is one choice. That is an Advantage plan in New Hampshire right now. Some people may have already even enrolled in it. It is an HMO. Does it have a drug plan built in? I think it does. I have not seen the formulary to be strong in my couple of shots at looking at that plan. Yeah, to answer the question, shopping the drug plan, whether or not it is an Advantage plan or a standalone prescription drug plan, is imperative that you do that, either on your own or with a professional.
But
Yeah.
could I just say what I think I
Sure,
understand?
please.
If you were on an Advantage plan that included drug coverage.
Yep.
You lose the Advantage plan.
Yes.
Then you need to buy
You do.
drug coverage.
And that,
But,
yes.
but Medicare Part D thinks you didn't have drug coverage before.
No, this is where you're wrong. So if you, yes.
Can we recap her question?
Yes. So the question is, if you were on an Advantage plan in previous years that had a drug plan built in, two parts. Do you need to get a drug plan, right? Second part would be to that.
Is there a penalty?
You would need to get a drug plan for a couple different reasons. Is there a mandate? No. You do not have to get on a drug plan. No one forces you to. However, two pieces of bad news. There would be a penalty for every year you go without being on a drug plan in the future. If you never enroll in a plan, you will never face that penalty. You will never. But if you did, say 3, 4, 5 years from now, think, shoot, it's really time, I need to go on a drug plan now. That's 4, 5 years of 1% the national average cost of plans for every year you go without being on a plan.
Did your question?
Which means,
It's every month.
yes,
every month.
which means $4, like roughly $4 for the first year, 2 years, roughly $8, 3 years, so 4 years, you're adding $16 a month onto that plan. You go 5 years now, you're adding $20 onto that every year.
It's a penalty.
It is
It's
a
like you lock
penalty.
into a price if you get the plan right away and not wait for years.
If you get, and like I said, there are 4 plans right now with 0 premium. Why not do it?
So
Why
I'm-
not just
I'm
enroll
to
in a
ask you about
plan?
what's the benefit of 0 premium? When you do buy the drugs, then you'll have a deductible of $600 or something?
You have a deductible. So the question is, what is the advantage of going on a drug plan? Does it really help you with your drugs if you have a $615 deductible and a $2,100 cap? What would be the reason to do that? Well,
You're never going to get the penalty.
You're eliminating the chance of having a penalty, as well as if you go without being on a drug plan and you then call me up halfway through the year and say, my doctor just put me on Eliquis, or I need to fill an EpiPen, or maybe even, you know, some of these other tier 3, tier 4 specialty drugs. You cannot just go on a drug plan any time of year. You have to wait until October 15th. You get on a drug plan starting January. That's when your plan, and you know, yes, you have a $615 deductible, but many generic drugs are zero cost, even in the deductible phase. They're deductible exempt. So if you had no drug plan, you would be paying for those prescriptions at the pharmacy. So why not? Why not at least just enroll? Pay attention to the star value on a plan. If you're not taking any drugs, you want to make sure that you've got a plan that's, you know, a 3-star or above, probably, because they're available. All of this stuff you can do on Medicare.gov. We're going to give you resources too before you leave if you wanted to do it yourself, or if you have neighbors, anyone you might know who is trying to do this on their own. There are some really great resources that you can leave with tonight. How'd we do? Did we get that? Okay. Do we get a question? Yeah.
So so why wouldn't someone just be automatically enrolled in a zero premium drug plan? Why isn't it just automatic?
Why isn't it automatic? If you are a low income subsidy person, it is automatic. Okay. If you are, the state will make that happen for you. But yeah, it is a lot of different steps. Already we're at 3 different cards, and we haven't even talked about dental or vision yet. So original Medicare, supplement, a standalone prescription drug plan, that's already 3 cards in your wallet compared to 1.
Now.
Enroll now. Yeah.
Because then you have the zero premium and it doesn't go
Yeah, and the question is a good one. Do you have more time after December 7th because you are losing your plan? I would just clean it up. I would just clean it up before December 7th just to be sure.
And I think if you don't like it, you have until March to opt out of it?
Yeah, I would just enroll by December 7th so that there's no confusion, or you're not in a holding pattern, or you're, you know, nobody's like, your application is sitting and pending somewhere. Just have it done by the 7th. And yes, we expect that probably after January 1, there are going to be a lot of people without insurance. This is going to be an unusual season. So you do have the 60 days after January to enroll as well. Shoot.
The drug cap, but that has to be approved drugs, is that correct?
The drugs, to get to the 20, yeah,
So the
to repeat the
question
question
is
is.
the drug cap.
Yep, so.
Because I take a very expensive, I have a $500 a day pill.
Yep.
So I paid last year $2,000 in January, and the rest of the year I didn't have to pay. So
The question is the 2,000 cap, which is in 2026 is going to be a $2,100 cap, does that include all drugs automatically? The drug has to be in the formulary. If the drug is not in the formulary, like I was talking about that gentleman with the other drug, if it's not in formulary, it will not be capped at that $2,100. Why you have to shop your prescriptions.
So I'm hoping one of those 4 plans will cover that.
Yeah, and we do the due diligence, you know.
And you're really stressing the importance of really
Shopping.
looking at your medications.
Yes.
But I want help with it, and the
We
earliest
can help.
appointment I have is like December 10th. And
Yeah.
all the other people say, you're on a waiting list, we'll call you when there's time. I've talked to 5 people, and they either can't do it because they're so overloaded.
We can see you before December 7th.
Okay, well, except now I'm going away and I won't be back until the
Yeah.
6th.
Yeah.
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 I mean, and what you're looking at right now is very tired agents. We are working 7 days
Yeah,
a
you
week.
said, I believe
If
it.
you need to huddle up and have a quick phone call with someone and it needs to be at 8 o'clock at night, we are not going to leave you behind. We will figure out a time to either Zoom, phone conference, or get you enrolled somehow, some way. Yeah. You don't want to wait until December 7th, I don't think. You do. Yeah.
Who compensates you guys?
How do we get paid is the question. How do we get paid? We are independent brokers, which means, you know, for tonight, we are not getting paid. For helping you shop a prescription drug plan, we do not get paid. There are only 2 of the 9 plans that give us a commission, and it's very low. The rest of the prescription drug plans do not pay us a commission. So when we sell a supplement to you, we get a commission for that. Sometimes Medicare Advantage plans will pay us a commission. Brokers like Duran Independent Insurance and Portside Independent Insurance, we have built a business model that does include an advisory agreement, which is optional. The first meeting that you have with me, there is no fee for that. If I helped you enroll in a prescription drug plan and a supplement, I will get paid by the supplement. If you decided, Nancy, I would like to have you more like an HR person. I have claims, I'm confused, this is my first year with a supplement. I want to be sure I'm meeting with you every year or every 6 months, 4 months. We charge an advisory agreement for that, and it is completely optional. $200 a person, $275 for a family. It is not part of the agreement or the first appointment. We will help you for free. Okay?
You don't have a private jet on that.
We don't. No, we don't. We don't have a private jet. But yeah, we are trying to help as many people as we can. This is not a normal season. Yep. Okay, so this slide is one of my favorite slides, and we do have this presentation that you can bring home. Because it very clearly writes, there are 2 paths in the woods, basically. Original Medicare with a supplement and a standalone prescription drug plan. That is the one way that you can go about Medicare. The other way is the Advantage plan, and perhaps next year we might have more of those, right? When you first turn 65, you have guaranteed issue rights in New Hampshire. When you first turn on Part B, turn 65, or become eligible for Medicare if you're under 65. There are some circumstances where that can happen. You have guaranteed issue rights to choose any supplement you want. If a few years from now you've chosen a supplement and you want to change your mind and move to a different plan, you do not have guaranteed issue rights. So making a decision that you perhaps may want to live with in case you cannot pass underwriting is a really good idea. If you have an Advantage plan right now, which is the one plan that does everything, if you are losing your Advantage plan, you have guaranteed issue rights back to a supplement no matter what your health history. I have that right? Yeah. Yeah, so all we need is that loss of coverage letter. We submit that with a supplement, and you do not have to answer health questions, right?
You automatically re-enroll in original Medicare, Parts A and B?
You're automatically enrolled in A and B, so the question then remains, are you okay with having that $1,600 deductible for Part A, all of those co-payments, that 20% co-insurance that goes on forever? If that's okay with you, that's original Medicare. If you would like to have a gap policy, otherwise known as a supplement, you would need to purchase that. And you can go on to the New Hampshire Insurance Commissioner's website, see all the different carriers and all the different plans to choose from. You do not have guaranteed issue rights to every single supplemental plan. It does depend on when you were born, when you picked up Parts A and B, why an agent can help you, because we will make sure that you're enrolling in the right plan. I can tell you, or anybody that's at home and listening to this presentation, we do know one thing about the Advantage crowd, and that is that you don't mind a little bit of cost sharing, and you don't want to pay a lot in a monthly premium. So looking at plan high G, high F, take the time to do that, because those plans are they're less in premium. They give you original Medicare as the primary insurance that allows you to go and self-refer wherever you want. Yeah, so the premium, the deductible, however, would be about close to $3,000, $2,900. It was just released. $2,950 would be your exposure. So that's where you would be cost sharing after Medicare gets done with all of your Parts A and B claims. You would have a stopgap. So no more of that 20%. No more of those co-payments after a certain amount of days. You would have a $3,000 cap, basically, where you're not worried about what happens if I go to Mass Gen for 3 weeks? Am I going to be paying 20% for, infinity? Yeah, you look confused.
Well, no, I'm not confused. I'm sort of, well, yeah, okay. It struck me when I was looking at this that I could either get into a position of a low monthly premium with a high deductible,
Yep.
or basically the option. And as I looked at that, it looked to me like it would probably all come out in the wash.
Yeah.
And that then, just depending on my current condition as to which to do. And then I look at my age and I look at all this shit. But is that a reasonable, I mean, what I'm looking at right now is the original Medicare with like a Part G,
Yep.
which I want to get from you.
Okay. So the gentleman is explaining he's done the research and he is contemplating if I went with G and paid a couple $100 a month as well as my Part B premium, I'm paying close to $400 a month with a $295 exposure at the end of the day. 285. That's one way you can go. And then you really have very limited exposure when you go to use the plan versus if you went with the high G, you're flipping the script in a sense and you're saying, give me the lower premium and I'll take on a $3,000 exposure.
Right,
and we'll
it's
pay
about
as we go.
$68 a month, as I recall.
And so you also have to consider in the next, 10, 20, 30 years, all of these rates are going to be squeaking up a little bit.
30 years is so optimistic.
What might be comfortable for you in a premium space today, if you can no longer pass underwriting 10 years from now, that's your plan.
Could you explain the difference between G and high G?
Yeah.
I sure can.
What is G?
So the question, we have your next slide. Yeah.
Hey.
Okay, there we go.
So the question is, what is G? So when we invented, the supplements in the state of New Hampshire, someone thought it would be a good idea to label them letters. So already we have original Medicare, which is A and B, Advantage plans, which is C, prescription drug plans, which is D, and now we have supplements that are also alphabet soup labeled A through N, right? Not all of these plans are guaranteed issue for you if you cannot pass health questions. So that's why you're meeting with an agent. We have with every single carrier which plans you would be eligible for if you cannot pass health questions. And it depends on your Part A effective date.
When you look at the
Yes.
things that are covered between F and G, F seems to sort of run the table with G only dealing with the Part B deductible. Can you expand on?
Yes.
Thank
Yes, so Plan F is the plan my mom is on. Plan F was very popular years and years ago because if you go with Plan F, you never have to pay a bill as long as everything's covered by Medicare. Plan F is just a cinch, no claims resolutions. But you can't buy F anymore. You can only buy F if your Parts A or B were effective before January 1, if you were born before 1955, January 1 of 1955, or if your Part A or B effective date.
It's before 2020.
Yeah.
So
Yeah.
your guaranteed issue is the Plan F. This is crazy.
So it's too good to be true, it's gone.
But, if you were to say, I want F, I would probably talk you out of it based on the premium. Because you sit down with an agent, we put charts in front of you and you show, this is the price for F. This is the price for G. This is the price for high F. And you may very quickly appreciate that with a high F, even if you met that $3,000 bucket, your end game might be much lower cost than paying a $300 monthly premium.
But go back to what's the difference between G and high G, or F and high F?
Yeah, so Plan G, okay, so repeating the question, what's the difference between G and F and high G? Really a deductible with Part B. If we're just talking about F and G, F, no deductible. G, you pay the Part B deductible, right? F, high F and high G are practically identical. It just depends on which one you're eligible for based on your birth date or when you became eligible for Medicare. So those high plans are both going to expose you to a much larger a max out of pocket closer to $3,000.
Oh.
I'm gonna help Mikey.
I've been working with somebody who said I had to take an F because I'd had a heart issue. Now, I'm way
I've heard that too.
Has nothing.
older
It's
than
not true.
1955, so.
Yeah.
No kidding.
Right.
And I've been on Medicare since, whatever, 2005, so is that true?
Do you already have F, a supplement that is
No,
F?
I have a Medicaid Advantage program, that's
Oh,
why
and you're
I'm here.
losing it, and you're losing it. So when we can certainly talk after the meeting, but if you have a heart condition and you cannot pass underwriting, there are only certain plans that you would be eligible for, and whoever advised you may be advising you that that would be the best plan for you. High F might be the very best plan for you to
That
take.
would be the guaranteed.
That would be the guaranteed issue plan, yeah.
Okay, but do you have to have a physical, or what do you have to do?
You have to have a loss of coverage letter from your Advantage plan, and that is it. That is all you need.
Good luck.
Oh, if you didn't want high F,
Well, I don't know the difference between F
Yeah.
and G.
right. So, and everyone is different. So that sort of, crunching of the numbers is a sit down with a broker, sit down with with a professional, and we'll show it to you on a piece of paper. Because, at the same time, what we'd want to be doing is shopping your prescription drugs too. When we meet with a client, sometimes it's an hour and a half. Everybody is different. You're not just, hey, you have to go with high F and that's it, and there's no other option. We want you to, by the time you're done with a meeting with me, I want you to understand what you chose and why you chose it, and not,
You
yeah.
said firmly that the brokers would turn me down for G.
Okay, let's talk.
This was something that happened 3 years ago, and
Yeah.
I've been fine ever since, so.
Okay, let's talk. It's a good conversation.
I don't know if this is relevant or not, but I've been on Plan G for 6 years, and I've had nearly $1 million worth of expenses, and I haven't paid a penny. So it worked for me.
Yeah. So it's more of a comment and not a question. Gentleman saying he's been on Plan G for 6 years, has had millions of dollars worth of care, and hasn't paid a penny. So probably at some point you do pay a Part B deductible. Maybe it's through either a lab or a specialist. At some point you pay that very minor Part B deductible. But after that, so G has worked out great for you. Yeah.
So G is covering that 20%.
So you're the
G is
problem.
covering the 20%. G will leave you with the Part B deductible of,
$283.
that's it, that's all annually.
What is the premium on G?
So, and you probably know with every carrier by heart, by age,
So Medicare supplement goes by age and gender. So depending on your age, it's going to vary. I would say somebody 65, first getting a Plan G plan, might be paying either a little under $200 or a little over $200 a month. If you're older, 70, 75, you might be closer to $250 to almost a $300 range.
and what's high G?
High G is maybe $50 a month to $70 a month.
Okay. Yeah.
It's very good.
Ready?
So for Medicare Part B, the premium is starts at $283 a month. But didn't you say that there's a higher
Sure.
monthly
Yeah.
if you have higher income?
Yeah.
Is that also,
Yep.
are the premiums for the alphabet soup of the supplement, do they also go up with income, or is that just a flat premium?
So the question now is in regards to IRMA, and there are acronyms all over the place in our industry. IRMA, income-related monthly adjusted amount. So we've been talking about what the Part B premium is. What are you laughing at?
Sorry, my head, I'm having a heart incident. I guess I can't get the, what's it? Yeah, it's okay.
Okay, so IRMA, income-related monthly adjusted amount, means some people get to pay a little bit more for Part B. And there are 4 different brackets above the held harmless amount. It's always a 2-year look back, and every day I'm meeting with someone new who did not know that you could appeal that IRMA bracket. It hits in 2 ways. It hits in the Part B space as well as in the prescription drug space. So, you know, you could be paying up and over $600 a month for Part B if in 2023, 2024, you were over $600,000 of income between you and a spouse. You know, if that's in your bracket, you will pay more for Part B. And so what happens is sometimes people stop working and they retire all at the same time as they're going on Medicare. And you know, you might have had a good year when you were 63 years old at work. You might have made a lot of money, but now you're on Social Security, or you've decided maybe we'll just live off retirements for a little bit, and your income is lower than what it was 2 years ago. You can appeal those IRMA if you are not making anywhere close to what you did. Or if it's like, oh, we just had a good year because we sold a property, or we sold our business, and it was just a one-off kind of a thing. You should definitely look into appealing that.
But does the premiums go up for like these supplements, the AD?
No, IRMA does not apply to supplements or to prescription drug plans, just to Part D and Part D and Part B. And a question there.
I am wondering if you're using the term cap and maximum out of pocket, and you had a third term. Those are all the same? I'm
Well,
really interested in what the maximum out of pocket
Yeah.
cost would be to somebody and what the differences are. And
Yep. So the question is mostly in regard to definitions of what is a deductible, what is a cap, what is a max out of pocket. For example, with a prescription drug plan, you will have a deductible of $615, and then you will have a cap of $2,100, assuming that your prescriptions are all covered.
$2,100 is the max out of pocket, same thing?
Yes, the cap and the max on prescription drug plans is correct. When we're talking about the supplemental high G or high F, the $3,000 exposure there is more like a cap, like a max out of pocket. Once you get to that number, as long as all of your care is covered by Medicare, and it's not, you know, with a provider who doesn't accept a Medicare contract, just like if a prescription drug is not in the formulary, it will fall outside of that cap. Yep. Get it?
Yeah.
Did I get it? Okay.
Well done.
Okay, yeah, and these are the IRMA brackets. So, you know, these change every year. They creep up a little bit depending on, yeah, and it's always a 2-year look back. If you have a late enrollment penalty. So a late enrollment penalty, if you didn't, yeah, right? So if you didn't enroll in Part B when you first became eligible, or you didn't enroll, we already talked about the prescription drug penalty, 1% the national average cost of plans if you went without a prescription drug plan. If you didn't enroll in Part B when you were first eligible, there is an accumulating penalty for Part B at 10%.
Can you, I have a person in this exact situation.
Yes.
10% of what?
Of Part B, of the premium for Part B. It is 10%, and then that accumulates. What's even not as nice is the timing. So if you are without Part B, you cannot just enroll any time, which is unfortunate. You're waiting until January 1, which is the open enrollment window, and then you can get Part B starting February 1st. So January 1 would be the time to do that.
But if that was a bunch of years that you didn't have it, you're paying 10% of that premium monthly as a penalty?
Yes, you are paying a penalty monthly, and some of these things can be forgiven for certain reasons. They can be appealed, especially if you are in a lower income bracket. Yep.
That's great to know.
Social Security office would be a great place to start. Yes. Yep.
For a joint tax return, married tax return, whatever, is it each person pays that much per month, or is it a
Yes,
couple?
yes, each person would pay the IRMA
Yeah.
separately, would pay the additional amount. Yep,
So it's not free.
it's not free. Oh,
Can you go through the application process, please, the health application process?
so if you were interested in enrolling in a supplemental policy, you could work with a broker. You could go to Medicare.gov on your own. You would need your Medicare card. The advantage to working with a broker is that we can track that application. We can tell you if there's an error. You know, you're not going to be sitting in a pending file somewhere. So we are keeping our eyes on that, tracking it, making sure that your loss of coverage letter is uploaded with the application, and making sure that all of your drugs are covered. But if you wanted to do it yourself, you could do that through Medicare.gov.
And through that process, that would be health conditions, that would be what drugs you're on.
You would want to shop the drugs. If you're losing your Advantage plan, you do not have to answer health questions, because I call it a golden ticket. If you are losing your Advantage plan, you have guaranteed issue rights, but only to certain plans.
Correct. If you want to go to any plan, then you would have to pass medical underwriting. And there's a page on the application that goes through all of that. Nancy will go through all of that with you.
Yeah.
But you do have guaranteed issue rights to certain
Your
plans.
paperwork here.
Yes, we could.
can tell.
Yes, we could talk to you about that.
Talk to you about it. yeah.
Everybody I talk to on the phone hangs up on me.
No.
As soon as I say my county doesn't have any Medicare Advantage, boom. It's
Yeah.
really been terrible. I keep trying to get paper that I can look at.
We're going to help you. We'll help you. Question in the back.
So I went through the process online, and there was no, I ended up not being offered, not being shown a high deductible G or F, but high deductible G. I'm wondering if, is that because I would have to do a health survey for that, or?
No, it should be there. It should be there as an option.
Okay.
It should.
There are some other ones
On
that are
Medicare.gov.
also offered. I know the one, after 2000, that one, I know those aren't available, but there are some others that were just seem randomly left out of my options.
Yeah, and when you are shopping through Medicare.gov, because I've done this before, you can look just specifically for prescription drug plans. But then if you're looking for supplements, it's in a completely different drop down. So I'd be happy to work on it with you. If you've already made a decision, if you're still in your window, we could help you change plans still. Yeah. Yes.
So what do you mean by window?
So when you first turn 65, you have 3 months before your birth month and 3 months after where you have guaranteed issue rights. And you can choose any plan that you want when you're first turning on parts A and B.
Okay. And if you miss the window, that's when this 10% penalty starts to
If you do not
take
enroll
place.
in parts A and B when you first are eligible, yes. Yep.
And what if you're on some other insurance, you're still working?
Yes.
So a good question is, what if you're on other insurance or still working? Sometimes I get this one too. What if I'm on the marketplace and I'm getting a tax credit and I'm paying nothing in premium? Not a good idea. If you are eligible for Medicare, those tax credits you are not eligible for anymore. You will have all of those tax credits clawed back at tax season in a future year. You must go to Medicare when you are eligible for Parts A and B. If you are on an employer plan, boy, is this turning into gray water. If you are on an employer plan, it has always been considered creditable coverage. And whenever you want, like a golden ticket, you can move on to Medicare. You can just turn that on whenever. The concern now in the broker community, however, is that group plan capping prescriptions at $2,100? And if it's not, will Medicare consider it credible coverage after, when you're ready to come off of that group plan? Technically, it's not creditable anymore. I'm talking, and then there's COBRA. Definitely, you do not want a COBRA because Medicare does not consider COBRA creditable coverage. So not only are you going to be in a gap of coverage and not being able to enroll when that COBRA ends, you could have a gap of coverage. But yeah, you're going to have problems because Medicare doesn't. There's going to be a penalty. Yep. Yep.
So I turned 65 in June, and I'm on my husband's insurance now, but he retires, and his insurance will finish at the end of January. So I won't have insurance February, March, April, May. Is there any penalty for that?
Can you repeat the question? I'm gonna.
My husband's insurance will end January 2026, and I turn 65 June 2026.
Okay.
Any penalty for just
Having a gap, So you could look on the individual market through the marketplace. You could get a plan for 4 months if you wanted to. Based on your income, it might be affordable, it might not. So is there a penalty for not having insurance? There is no penalty. The Affordable Care Act still happens to be the law of the land where everybody is supposed to be securing insurance, but there is no penalty for not having insurance. When you're coming off of a group plan, you do have a 60-day window where you could elect COBRA. You could when you're under 65, just not after. Yep, so you could elect that COBRA. And you could get with any one of us too and say, and just, even just tire kick. What would the cost be for 4 months? Does it make sense, doesn't it?
Well, wouldn't Medicare kick in 3 months before her
No,
birthday?
Medicare is going to kick it. So the question
you have
is,
to enroll. You can enroll 3 months before, but it doesn't.
Right. If your window is 3 months before your birth month and then 3 months after, your actual Parts A and B effective dates will be on the first day of the month of your birth month.
Oh.
If you enrolled 3 months in advance, you cannot get a future or an earlier effective date. It would be on the first of the month. The only way that is different is if your birthday's on the first day of the month, then your Parts A and B effective dates are the month before. That is the only time that is different.
I just had heard that there was a penalty if you show up and want Medicare and you don't have insurance. No, that's not true.
If you want and
Only
you don't,
when you're already 65. So if you're 68 and you've had no coverage, then yes. Or if you're on an employer plan and it's not credible, then yes. It's when you're under, right, you're 63, 64, not eligible first for Medicare, that you wouldn't have that. But if you're over 65 and you don't have credible coverage, then that's when that penalty kicks in.
And then what happens if you get sick in that period and you show up to Medicare with a pre-existing condition?
you're fine.
You're fine.
Yeah, so the question is, what if you're sick in that period? Do you still have guaranteed issue rights, or would you be rated or perhaps even turned away if you had a pre-existing condition? No. Yes?
How do you know if your insurance is credible coverage?
How do you know if your insurance is creditable? So every year your employer should be sending you a letter that says, and you keep those on file, so that when you are ready to leave your employer coverage, you can present that to Medicare. There's a couple forms if you're 70 years old and you want to sign up for A and B and you don't have A yet. There's a couple forms in L564, 40B. You submit them to the Social Security office. We can help you. And then your employer is actually signing off on that, saying that you had credible coverage all of that while because you were still working. Yep. And that will alleviate any penalties. Yeah.
Ouch.
How are we doing?
I like that.
It's a lot.
Where you say clear as mud?
Clear as mud? Is that clear as mud? Am I missing anything?
Are you going to do dental?
Okay, so right now you have 3 cards, but you could have 5. You could also have a dental card. You could also have a vision card if you wanted. And those plans you can buy any time of year with no pre-existing condition, no waiting periods. Years ago, there was a 3-month waiting period for basic restorative or 6 months for major restorative. Those plans you can buy at any time. They go into effect on the first day of the month. You could have a root canal on the first day of the month and it would be covered. If, sometimes they're cost prohibitive, $40 to $80 a month in premium. If all you're doing is getting cleanings and x-rays, you may decide to opt out of dental insurance, but it could always be one of those things you just call us when you're ready to turn it on. It's a 12-month commitment. That's for dental.
How about ears?
Vision, vision.
Hearing.
I know. So vision, VSP, vision insurance, has a true hearing benefit built in. And some people enroll in the VSP, vision insurance, just just to get the hearing aid benefit. You have to use their providers. You know, they're 60% off state-of-the-art hearing aids, and those premiums are between $16 and $24 a month.
Wow.
Yeah, so that's some of the best we've been able to find that will cover.
That covers the expense of hearing aids?
Yeah,
The
so
high-end
the VSP does. It will cover, you know, up to 60% off.
Nancy, you said something about you have to use their providers. Can you speak
Correct.
to this accessibility in our area?
Yes, well, in Wolfboro, we have one provider that does accept VSP insurance, so I think we have that same provider in North Conway, so you're not going to be driving very far. And you would get that hearing aid exam capped at $15. And then, you know, and then you would decide whether or not you wanted to purchase the hearing aids from her, or, you know, at least get on the radar and find out, when do I need hearing aids, 6 months, 2 years from now. But you could at least get the exam done and then speak with her about whether or not it makes sense. I have had some clients decide, you know what, instead of the 60% off, maybe I'll just buy last year's model, and that would be even a better deal. So it really does depend on what type of hearing aids you want.
Or Costco too.
Or right. But
Mine are Chinese.
Also covering vision and
and that the VSP will also give you 60% off on nice frames and lenses, bifocals, trifocals, and a $15 capped eye exam. But you do have to use their. Yeah, VSP. I do have some brochures here tonight. Well, VSP, I think, is it fair for me to refer people? Yeah, Rochester Eye Care is great. They accept the VSP contract. I mean, it does depend on your zip code, but Rochester Eye Care, they are accepting referrals, and they do a very nice job. They have a nice selection of frames and lenses. Yep. And then,
We have
yeah.
dental brochures up there too.
Dental up there too. So yeah, 5 different cards is what your, you know, potential. But both, again, with the VSP and the dental, any time of year, if you just really wanted to get settled with what am I going to do with the drugs and the supplement now, as soon as you enroll in the dental and the vision, you're paying a monthly premium. So if you're not using it, I would say hold off until you're ready. You know, if you have it, I'm going to get glasses in the summer, wait till the summer to enroll.
Would you speak to shopping your providers for dental?
And dental, yeah, so not all, in Wolfboro, we have only one dentist who is in the PPO network. The rest of them are in the Premier network. So when we're sitting down with someone talking about, does dental make sense for you, that's one of the first things we talk about. Who is your dentist? What are your dental needs? All of that matters.
What's the difference between Premier and PPO?
What's
the difference between Premier and PPO?
So what is the difference between Delta Dental's 2 networks? One is a PPO network, one is a Premier. The Premier network is $88 a month. The PPO network plans are between $40 and $70 a month. There's 4 of those to choose from. And basically it's contracted rates. It is contracted rates depending on the plan. If you're in a PPO network, you would agree to a lower contracted rate.
But fewer providers, is that,
Yep.
or a different network?
Yeah, the Premier network is almost all providers, but they get paid more. So, yeah.
But providers only contract with specific networks, like PPO or
Yeah.
Premier.
Yeah, and this is where we huddle up.
Yeah.
You know, this is where we huddle up and we look at all the 4 different plans, figure out what is it that you need. Do you need root canals, implants? Do you need denture stuff? Do you need fillings, or do you just do cleanings? And we will help you choose a plan and the timing of the enrollment as well.
That's when you're not dealing with 5,000 people.
5,000 people losing insurance. So yeah, that's, you know. Yep.
I realize this is a hypothetical question, and you probably knew this was coming, and I probably don't suspect you have a real clear, direct answer, but on the other end of the coin, you've got lobbyists, and I'm sure they have an idea.
Yeah.
This is a great opportunity, and thank you for coming.
Sure.
I appreciate that.
Yeah.
But what happens in 6 months when they decide they're going to do severe Medicare Advantage switch around? I mean, what happens, what comes under the scrutiny?
Okay.
What's the backup plan?
Yeah, so the question that we just asked is, I think specific to what happens when legislative offices, make laws and rules change, and then we're all at the mercy of, and insurance companies are feeling that heat as well. We have the Dems in office, and then we have the Republicans in office, and the laws continue to change based on who's in, and we're all at the mercy of, okay, well now what insurance policies do we have to choose from? What do we do now? And this is, very similar to when the Affordable Care Act first came out. I remember when the website didn't even work for 2 hours. I would have clients come in at 11 o'clock at night and then go home, take a nap, and I'll let you know when the laptop stops spinning, when we're waiting in a doorway. So, the Affordable Care Act was not perfect when it first came out, and it has evolved, and, the same thing I think is happening right now in this advantage space is we're up against legislative changes, and we all have a voice, and we need to be reaching out to not only the insurance commissioner, but our Congress people, our senators, and explaining to them, because this is about to become a community problem, I feel, is when people find out they don't have insurance in January. You're all here learning your options and probably going to, enroll and make good choices. We were in Sandwich the other night, and we were talking to people who, were very concerned about not everybody has the opportunity to drive to a meeting like this, to have a laptop in front of them, to understand what their choices are. So in January, your meds aren't going to be covered. It is going to become a community problem. Yep. And
75,000 lose their insurance in New Hampshire.
Yeah.
Many of those will end up going to emergency rooms or whatever in the new year if they haven't managed to get new insurance.
And the same thing will happen with the under 65 space when people are looking at their health insurance premiums. I've been meeting with families of 4, and the parents are saying we're going to go without this year because of the advanced premium tax credits going away. Yep, so we're going to at least insure the kids, or who's the sickest one in the family. Does the hospital have to take them at that point? Do they have to administer care? And is that going to then become a problem with the hospitals having to bear the load? Will we see hospitals close, potentially? Potentially,
And do the
yeah.
hospitals then bill the state?
Good question I don't know the answer to. Good question.
Find out.
Let's go for it.
We're only fortunate, and the memorial is rather well endowed.
Yeah.
And subsequently will resist a good deal of the closures that are to come.
Well,
Yep.
no, in
Repeat that.
Yeah, so now, we're just having a conversation of what is it gonna look like when the hospitals have to bear the load? And are some hospitals are they gonna be in a position? Are they gonna have, dollars behind them from the community to keep them afloat?
Well, it switches from becoming a health decision to a political decision.
Yep.
no, I can just say in the New Hampshire state budget for 26-27, the legislature anticipated higher, what they call, it's lost coverage for hospitals where they treat people who can't pay, don't have insurance or can't pay them. And so the New Hampshire state budget increased the pocket of money that goes for those care for uninsured people.
Okay, yep, question?
Isn't this exactly what happened before we had the Affordable Care Act?
Is this exactly what we had before the Affordable Care Act is
I
the
mean, as
question?
far as people couldn't pay their bills, the hospitals were suffering because they have to take you to the emergency room.
Yeah, so, for the live people streaming, we're just having political discourse about, isn't this exactly what happened before the Affordable Care Act? As soon as we're trying to fix the system and make it better, are we going right back to where we were before? As independent agents, we are not disputing the fact that the systems do not seem to be affordable right now. There are a lot of people marching in the streets, and they're saying our insurance premiums are doubling, and we are seeing that in real life. I do not have the answer, but it is worth a community conversation more than just tonight, I think. Yeah. Yep.
My big question remains, what of the Medigap policy or ADA actually has a maximum out-of-pocket cost? In other words, so if something catastrophic.
They all do. So the question now is, of all of the gap policies, will you be capped? Will you not have and yeah, so,
Cost maximum.
Yeah.
And then they cover everything else.
yeah,
covered.
yep, the
All of them
supplements.
have that.
So, yes, all of them have, well, I can show you the charts, then we can have a little chat, in 5 minutes. I would say G is probably your best bet, which gives you that Part B deductible, and that's it. You cannot do better than G right now. High G, $3,000, and you're done. So that's also a really good take.
Unless you have guaranteed issues to
Plan N. Guaranteed issue. Plan F is also, but Plan N is a great take. Those are probably the majority of the plans that we write, and is a little bit different from G because you're taking on some co-payments. If you wanted to see a provider or a specialist, you'd pay up to $20, up to $50 to the emergency room. So a little bit of cost sharing with Plan N, but a lower premium.
But again, so does Plan N have a maximum for the year that you're out of pocket?
I guess those co-pays would go on forever.
That's what I'm saying.
Yeah, those co-pays
Right,
would go on
So
forever.
the emergency room visits, if you had a lot of them, you could.
Yeah,
get up
yeah,
to
you're right.
10,000.
Yeah, no cap on the co-pays.
That's what I'm wondering, which
Yep.
are the ones that have some total cap
Yep.
on your out of pocket?
G,
High G.
high G.
G and high G, that's it.
Well, they're,
Or L?
well, I mean, there's like A through N, right? So A through N.
I'm
Each
just
plan
wondering.
is a little different.
Right, I know.
It's kind of like a 20-minute presentation where we go through them one by
That's
one.
the,
Okay, and I don't need to get into that, I'm just wondering.
But you have the chart there
Yeah,
in your
I have the
lap.
chart.
You see where it's A through N and there's the L and K and you see the cap right there. I'll show you the
Yeah,
page.
because they, sometimes, like in G, the out-of-pocket maximum is the deductible. No, yeah, it is.
Yeah,
And so that gets confusing in my mind, it's like, are we talking about, it says it says deductible 257, but then I'm wondering, are there additional costs? But you're saying there are no additional costs.
with G, you've got that Part B deductible, that's it, that's all. As long as you're using all, as long as everything is in your network and
Right.
medically necessary, yeah, you're not gonna pay more than that Part B deductible. Yeah,
Thank you.
okay. Anybody else? Sorry. Sorry if I hurt your brain. That's a lot. And I know
Really
it's a
good.
lot, but
It's a
Yeah.
How did you learn all that?
how did I learn?
Thank you.
Thank you.